if you had ACL surgery and your doctor wants you to wear a brace after surgery, I'm going to show you how to properly fit the brace for your leg and how to properly put it on. In all my years of practicing, I've never had one person come to me on their first session and the brace fit how it should. Now, part of that is because when the brace is put on you, you're in the recovery room, and the nurses, as good as the job they do, they're not too good about putting on braces, and they also have to deal with the huge bandage on your knee. Okay, so the huge bandage is going to take up space, and they have to put the brace around that, and then when the bandages come off, the brace doesn't fit right. Okay. So this brace is a Brig T-Scope Premier. They come with instruction manuals. If you're watching this video, obviously you tried looking at that and didn't know what to do. So we'll get rid of that. Now, a few important things when putting on the brace. First thing, make sure it's the right way. Okay? Big pads are on top, the smaller pads are on the bottom. I know it sounds silly, but there have been people who put it on upside down. Okay. So you got the brace the right way. Now, when you put your brace on, you want your leg to be as straight as you can. Okay, you don't want it to be bent. Okay, if it's bent when you put the brace on, it's not going to fit right. Okay, you're not going to be able to move around well in it, and you're not going to be able to walk properly with it. Okay, so you want your leg as straight as you can. I know for some people, getting it straight is tough. It doesn't feel too good, but you have to just get it as straight as you can, get the brace on you, and then you can relax a little bit. Okay, so your leg as straight as you can. You want to center the brace, the circle part, right around the center of your knee. Okay. What we see a lot is the center of the brace is below the leg, below the knee. Okay. So you want to make sure the center of your knee has the circle pads, the circle part of the brace right there. Okay. Now, once you have that centered, what you want to take note of is how long the brace is. Not all braces have this, but this one is nice that it does. It has an adjustment where you can adjust the length of each of the arms. So you can do that on the lower part, you can do this on the upper part. Everybody's legs are different lengths, different girths, okay? There's not an exact science as to exactly where it should hit. Okay? The length of it will be more for comfort. Sometimes the brace is a little too far up into the groin, and that doesn't feel too good for obvious reasons. Sometimes people have big meaty calves or just funny shaped calves, and you want to play around with where that hits. That's fine. So you adjust the length of the arms mostly for comfort. Okay? So you have the right length of the arm, you have the brace centered around the knee. Now the next thing you have to do is make sure that the arms are directly on the outside and inside of your leg. Okay, what happens a lot is the arms will be like pointing up towards the ceiling. They'll be up too high. Okay, and again, this happens because when you have the big bulky bandages on after surgery, they have to get the brace around that, and then you take them off and the brace comes too far around. So it'll come too far around and the brace will be like on top of your knee there. And again, we want it directly on the side. So the way to adjust how far the brace comes around your knee is with the length of the straps in the middle here. Right. Now you'll see that these pads, they pop off, they're just Velcro. You didn't break it, don't worry. Right. See, on this side, I can't adjust the strap. So most braces, the strap is adjustable only on one side, okay, not both sides. If it is adjustable on both sides, I only recommend adjusting one side just because it gets less confusing. So we'll take off the other side. And again, only do one level at a time so that you know which pad goes where. Okay, all the pads are a little different size. And you'll see that you can then adjust. If you undo the Velcro, you can adjust the length of the strap like that. So this brace is really nice because you don't have to remove these pads. Okay, most of the braces you have to remove these pads. This one, all you have to do is lift up this tab. tab right here, and then it slides. Okay. So the beauty of this brace is you can actually adjust it while it's on you. So I'm going to line up both sides, both arms, so they're nice and straight, and then I'm going to adjust the length of the straps. If you're doing it yourself, you probably have to just run through a few trial and error type things. If you're doing it, having somebody else do it for you, it goes a lot faster. So we'll hook on the strap, and we'll adjust the length of the brace. You're going to have to do it on each level. You want that right on the outside and inside of your leg. Now you'll see once you adjust the straps, they're going to be long. For most people, they're going to be long. You can leave them like this and kind of wrap them around your whole leg or wrap them on the outside of the brace. Or what I usually tell people to do is trim them. So you can just cut these. There's just a Velcro strap. You can cut these, and then usually the Velcro attachment, something like this, just comes off and you can put it back onto the spot, the length that you cut. So if you cut these, and then you can put it right down on the strap right in front of you, so it's a nice clean look. This isn't my brace, so I'm not going to cut these. So I'm just going to wrap these all the way around. When you put them on tension-wise, you want it to be snug. You don't want it to be loose, because the whole brace will slide up and down. Okay, we don't want that. It'll end up by your ankle. You don't want them too tight, because then it's just going to squeeze your leg. Nice and snug. You'll see by the bottom, that one's usually the longest, or has the most excess, I should say. So you've got the brace lined up on the inside and outside of your leg, centered at the knee. Knee was straight when you put it on. Now it's good to go like that. And now what I want to show you is how to adjust how much it can bend. Now how much it can bend and adjusting that is something you should absolutely talk with your therapist about. Okay, but I'm going to show you how to play around with the dials just in case they come open or somebody plays around with it for you because they're bored. Or if you just want to have a little bit more comfort when you're sitting, which is usually why I tell people how to open them up. So you'll see there should be some type of locking button. Okay, on this brace it's this orange button right here. If I unlock that, the brace now bends. Okay, I lock it, it doesn't move. Okay. On one side will be, it'll say EXT or extension. That's how straight your leg gets. Okay, that you shouldn't really play around with. That should just be at 0. Okay, and you shouldn't adjust that one. What you might adjust is how much you bend it or how much you flex it. Okay, so to adjust the dials, you pull up on them and then you can move them around. Okay. What might happen is if you're locked in extension, maybe after a couple sessions, your therapist might open it up to maybe 30 degrees or 50 degrees, something like that, and then progressively get more and more. Or what I tell my patients is if you put it on 90, okay, and then you put the other side, do the same thing, get it on 90. If you only do one side, it's not going to move. Do both sides, and then you unlock it. It'll bend to 90. Okay, it won't go past that. Okay. Why do I tell my patients about that? Just so that's a little bit more comfortable when they're sitting, or they go in a car or something like that, sitting in class. But you can unlock it to 90, okay, and then before you get up, you fully straighten your leg out, and then you lock it again. Okay. So there's a few different things you have to worry about or think about when you're getting the brace on, getting it fit properly. A proper fitting brace really does not make that much of a difference because it won't chafe your leg, it won't be annoying, it'll be comfortable. and it'll give you the support that you actually need, okay? Also, a brace that doesn't fit right can actually cause you to lose more motion and make it harder for you to regain your motion. So you absolutely want to make sure your brace fits right. It's something your therapist should go over in the first session with you, because I can guarantee you it's not going to fit well after the bandages come off, and it's that important to your rehab.